There are various factors that are contributing to Patrick's poor respiratory symptoms. Firstly, he was a smoker for approximately 40 years. Cigarettes damage tissue and cells throughout the respiratory system, especially in the lungs, as this is where the chemicals are absorbed. As a result, smoking causes lung diseases, including chronic obstructive pulmonary disease, which Patrick has. Furthermore, it increases the chances of respiratory infection and chronic diseases. Secondly, Patrick's myocardial infarction and his COPD are possibly contributing to his respiratory problems, including his dyspnea. Due to damaged heart muscles during the myocardial infarction, his heart struggles to pump blood around his body. This can lead to a range of respiratory symptoms for Patrick. There are also non-modifiable factors that contribute to his respiratory symptoms, such as Patrick's age and gender. Patrick's heart rate is currently at 155 beats per minute, which is well above the normal range of 60 to 100 beats per minute. His medical history and current conditions show numerous factors that have contributed to this. Patrick suffers from chronic obstructive pulmonary disease. This consists of both emphysema and chronic bronchitis. Over time, COPD causes hypoxia, low levels of oxygen and hypocapnia, and high levels of carbon dioxide due to the alveoli getting destroyed over time due to the toxins in the lungs. In order to compensate for these levels and boost oxygen delivery, the body narrows blood vessels in the lungs, leading to pulmonary hypertension. There is also a growth in red blood cells to increase the blood's ability to carry oxygen. Furthermore, it increases the heart rate to pump more blood, and in turn, the breathing rate of the individual increases. Along with his COPD, Patrick suffers from dyspnea, which is a subjective awareness of shortness of breath or uncomfortable breathing. For most people, dyspnea develops due to multiple health factors. It is most likely for Patrick his dyspnea aroused from his COPD and his heart failure. Dyspnea increases the individual's heart rate. How dyspnea works can be a complex movement involving the activation of multiple pathways, ultimately leads to an increased work of breathing, stimulations of the receptors in the upper or lower airway, lung parenchyma or chest wall, and excessive stimulation of the respiratory center by the central and peripheral chemoreceptors. Another factor is leading to his short of breath for Patrick is his worsening left-sided heart failure. Left-sided heart failure can also cause symptoms of high heart rate due to the heart working more in order to pump enough blood around the body to meet the needs of the body's tissues. Chronic obstructive pulmonary disease is a long-term disease of the lung which causes an array of health problems for the individuals, such as repetitive coughing, shortness of breath, and an overall lessened quality of life. It includes both emphysema and chronic bronchitis, which are not reversible. COPD causes the bronchioles and the alveoli to lose their elasticity, destroys the walls between the alveoli, and causes bronchioles to narrow due to mucus buildup. It is evident that due to Patrick's long-term smoking habits, he now suffers from this debilitating disease. Left-sided heart failure occurs when the left ventricle doesn't pump efficiently, therefore preventing the body from sufficient oxygen-rich blood. Instead, the blood clogs up in the lungs, causing shortness of breath and a buildup of fluid. COPD and left-sided heart failure are not directly related. However, it is very likely that the two conditions can exacerbate each other at certain times. For example, when blood is not appropriately oxygenated due to the individual's COPD, extra stress is then placed upon the heart, therefore worsening symptoms of the left-sided heart failure. Conversely, due to the excess fluid in the lungs from the left-sided heart failure, this tends to make breathing more difficult for individuals with COPD. Overall, it can be seen that these two diseases can influence each other. However, they do not cause one another, as COPD is usually caused by smoking and left-sided heart failure is usually a result of high blood pressure and coronary artery disease or from damage to the heart muscle. Right-sided heart failure could be a comorbidity that Patrick could experience due to his diagnosis of left-sided heart failure. Right-sided heart failure on occasion can be a result of left-sided heart failure when an increase in the left ventricular filling pressure is redirected back into pulmonary circulation. As the pressure in the pulmonary circulation increases, the resistance to right ventricular emptying increases. The right ventricle is inadequately prepared to compensate for this amplified afterload, which causes it to dilate and fail. Patrick's chronic obstructive pulmonary disease can also make him more susceptible to right-sided heart failure. As discussed earlier, COPD will directly affect Patrick's lungs and make it harder for him to breathe, causing a decrease in oxygen supply for his body. Patrick's lung disease will also cause a rise in pulmonary vascular resistance over time. The heart attempts to overcome this change by increasing contractions in the right ventricle. This increased pressure on the heart constitutes for a greater demand of oxygen supply for the body, which Patrick's COPD may not allow for. This in turn causes right ventricle hypoxia, which then results in a decreased force of contractions in the right ventricle. Less contraction force in an increase in the end diastolic pressure of the right ventricle. This causes an increase in right ventricle preload, which causes a higher demand for oxygen and continues this detrimental cycle. Heightened preload in the right ventricular will cause reflected increase in the preload in the right atrial chamber, which leads to peripheral edema. Patrick is experiencing swelling from the knee down, so this could be an explanation as to why. The levels of ions within the cell need to be maintained in the appropriate range for normal cellular function. This is especially true for the relative proportions of the electrolytes sodium, potassium, and calcium, as these are essential for neurons to function. According to Patrick's blood test results, he has a high level of sodium. This indicates that he is experiencing moderate hypernatremia, and could also be a contributing factor to Patrick's high blood pressure. Abnormal sodium levels can be caused by too much salt in a person's diet and can cause dehydration or edema, which Patrick is experiencing in his lower limbs. High sodium levels can also cause an increased heart rate, which Patrick is also experiencing. Patrick's potassium level is also slightly high. Potassium is a nutrient that is critical to the function of nerve and muscle cells, including those in the heart. High potassium levels are known as hyperkalemia. Hyperkalemia affects many organ systems. It can cause heart muscles to malfunction, leading to a heart attack. Cell damage results in the release of potassium into the extracellular fluid, and if Patrick is experiencing hypoxia, this could be the cause of his high potassium levels. Calcium is essential for normal cell function, neural transmission, membrane stability, bone structure, blood coagulation, and intracellular signaling. Patrick has a lower than recommended level of calcium. This relates to Patrick's neurological function, as symptoms of hypocalcemia include neuromuscular irritability, such as muscle twitches. This is due to the key role calcium plays in neuron action. Patrick's hemoglobin level is marginally low. It could indicate that he is slightly anemic. This could be caused by his reduced oxygen intake due to his COPD. Patrick's cholesterol levels reflect a high intake of low-density lipids, which could be caused by poor dietary choices. Cholesterol can weaken or even block arteries, and as Patrick's heart is already experiencing poor function, this could further worsen his condition. Patrick also has a slightly high blood glucose level, which could indicate diabetes and poor dietary choices. It would be beneficial for Patrick to have another blood test done to show his arterial blood gas value. ABGs are measured to determine oxygenation status and acid-base balance. This test is performed to assess how well your lungs are able to transfer oxygen into the blood and remove carbon dioxide from the blood. Getting an arterial blood test for Patrick would allow further insight into the severity of his COPD and heart failure, and would provide the best analysis for the acuteness and severity of his disease exacerbation. Due to Patrick's COPD, he would potentially have hypoxemia and may develop hypercapnia. Normal arterial blood pH ranges from 7.35 to 7.45. Both COPD and heart failure can be indications if this test comes back with an acidotic result of less than 7.35. This is due to Patrick's compromised gas exchange caused by his chronic diseases. It could be anticipated that Patrick's blood pH level could be normal or acidic, which indicates acute respiratory compromise. The partial pressure of carbon dioxide measures the CO2 levels in the blood and reflects the state of alveolar ventilation. A low pH with a high partial pressure of carbon dioxide suggests respiratory acidosis. A normal range would be between 38 to 42 milligrams. For Patrick, we would expect a higher partial pressure of carbon dioxide level due to his compensated gas exchange. Thank you for listening to our presentation.